The Bonds is a very special place to work. It has a fantastic ethos of caring for its patients. Things are done efficiently.
We take every sort of a medical or surgical patient that is allocated.
I found the Bonds is really unique in different areas. One of the important things that the standard of care is very high, and there is no comparison to all the places I work in, say Canada or Saudi Arabia or Sudan. We have a very good standard of care.
We have 4 RMOs that are attached to the ward, which would be very accommodating. They are very knowledgeable.
My subspecialty area is paediatric neurology, and for that you need really quick access to things like EEG and MRI scanning. And I suppose the fantastic thing about working in the Bonds is that you can get those things within the week if you need it, within the day if you want it and really need it.
Acting as a neurologist, a pediatrician neurologist, and we are the 2 consultants working in the Bonds. We deal with general pediatrics, this is the main important area, and then there is other interests or areas where we can deal with also. When I say specialized divisions, there is say neurology, or there is cardiology, or there is nephrology. Most of the higher specialties are in Dublin, Crumlin and Tala. I have interest in neonates. The neonates are the small babies. And this is one of the reasons I did some international work and collaboration with other places to progress on that area.
We can have anything from meningitis to bronchiolitis to a diagnosis of a tumour on the ward on any one day. We have 19 beds, so there are 3 multi-bedded rooms. The top room is for day cases, so children who come in for tonsillectomies or elective procedures. The middle room then is for the toddlers, so there's 4 cots in that room, and these are little ones who come in with, wheeze or tummy, well, not tummy bugs because they're isolated, but wheeze or viral conditions that need to be treated. Then the next room down is sort of a medical room, so bigger kids go into that room. There's 4 beds in that room, and then down the other side of the corridor, which we've recently renovated, you have 3 isolation rooms for toddlers and 3 isolation rooms for the bigger kids.
Our acute admissions can either be surgical or medical, and the medical then depend on what consultant's on call, either Dr. Sammy or Dr. Lynch. And the medicals, if they're a general surgeon, depends on what surgeon is on call, like appendixes and things like that. The urologist is obvious enough, it depends which urologist is on call, so it's an on-call basis. Once they're acute, that sort of way. If they're previous admission under the consultant, they'll come back on under that consultant for continuity of care.
And what we have in the Bonds is a consultant delivered service. So I see all of my patients and I make all the decisions, the ultimate decisions on their treatment. Children tend not to be sick 9 to 5, Monday to Friday. It tends to be, the middle of a night on a Saturday. And you go through the usual process then. We don't have an emergency admission service, an emergency room in the Bonds course. So you go to your GP or to South Doc, and they will then make the decision as to whether the child needs to be admitted, and then you come into hospital and you get treated accordingly. You just feel like you're making an important contribution to the lives of children and their families.